As RSV cases continue to rise across the United States and especially here in Wisconsin, we're joined this morning by Dr. Kathryn, a pediatrician with UW Health Kids in Madison. Dr. Less, thank you so much for joining us this morning.
Happy to be here.
So the disease known as RSV may be kind of unknown to some people. So could you just begin by explaining what RSV is and how it affects certain age groups?
Absolutely. So RSV is short for respiratory syncytial virus, which is a fancy name for another kind of upper respiratory infection. It often presents kind of like your typical cold in most adults and children. However, younger children, especially those under a year, are at a little bit of a higher risk for having more significant symptoms. So that age group in particular is a little bit more prone to developing something called bronchiolitis, which is inflammation of the little air sacs in the lungs that can make it a little bit harder for them to breathe.
What kind of symptoms does RSV come with, and when should people seek help for either themselves or for their young ones?
Absolutely. So most of the symptoms are going to be cough, runny nose, nasal congestion, those sorts of things. And the good news is most children and adults for that matter get better with just some good supportive care at home, but it's always really smart to keep an eye out for symptoms that they're working harder to breathe. So those can look like, is your child working hard? Are they breathing faster, much faster than they normally do? Are they using extra muscles to breathe? Does it look like the skin is tugging in between the ribs, tugging in at the bottom of the neck? Are they bobbing their head, flaring their nostrils, making grunting sounds with each breath? If any of those symptoms are happening and they don't improve with a good nasal suctioning, those are times that we would recommend seeking medical care.
Definitely important to watch out for those symptoms. And as of right now, since there's no vaccine, what can be done to help the symptoms of RSV?
So good supportive care is kind of the staple to help getting through this illness in time. So the most helpful thing is really nasal saline sprayer drops and nasal suctioning for the littler kids to try and help clear away that mucus. If you think about how small the airways are in younger children, a stuffy nose in a baby makes a much more significant impact than in an older child or in an adult. So trying to see what we can do to clear out that mucus is super helpful. Spending 15 minutes or so in a steamy bathroom can help loosen up that mucus. And then encouraging hydration is another key component. So babies often don't take the same volumes of breast milk or formula as they do when their nose is congested because it's hard to feed and breathe at the same time. So offering smaller amounts more frequently can help make sure that they're staying hydrated.
Definitely all important tips for parents and for everyone when it comes to this disease. Dr. Less, again, thank you so much for joining us this morning.
You're so welcome.